Welcome to a TRE session. Here I am starting to show some examples of quadriped tremoring, and we have a lot of side-to-side hip movements here. So I'm finding that a lot is being unlocked here. You can see very interesting tremors here, different than my normal lying on my back tremors. So a lot of side to side, and I'm using my neck muscles to hold my neck up because that feels like the most aligned, best way to hold my body. The interesting thing about this position is that we are having to use some effort, obviously, and muscular engagement to be in this position and for me to hold my neck up. And I could let my neck down, but and I don't know how to explain this very well, but something about my body was just signaling to me to keep my neck up. And with this practice, it's a lovely experience of following bodily signals, even if we can't explain with our mind why we might choose a certain position. So the reason that I'm going to be engaging in this position more often, see some rapid cat-cows here, lovely. The reason I'm in quadruped position and will continue to do so is because I've been experiencing some, you could say, imbalance in the loosening of my fascia and tension from just lying on my back tremoring. So I tend to have an anterior pelvic tilt, which is where the butt sticks out a bit, and there's a excessive curve in the lumbar spine. I naturally have that for a long time now. And I found that lying on my back tremoring was loosening the abs even more and causing we could say not causing, but not helping the tension or the habitual contraction in my lumbar erector spinae, my lower back muscles. And so when we do a certain position for a long period of time, just think about the imbalances, so to speak, in the TRE's effect, and that it might be, and I would say in my case is important to reverse that. So gravity's operating in the opposite direction here, and so opposite muscle groups are contracting against gravity. Here I'll have more contracting of my lower back muscles, giving them a chance to play out their uncompleted tension loops. Whereas before, when I was just doing primarily on my back tremoring, the psoas in the front, which is the primary hip flexor muscle group, was the muscle that was getting its chance to contract many times, hundreds of times, maybe thousands over the course of months of tremoring. And my lower back, not as much, although some. But here it will be a lot less psoas, I imagine, and I'm experiencing more lower back contractions, and I'm frankly very excited about the prospect of benefiting my anterior pelvic tilt, because it was not being relieved or balanced out anymore for months and months now with my back tremoring, my lying down on my back tremoring. And you know, when we try different positions, whether it's subtle or a very obvious different position we're trying, then we're in a way hitting our body from different angles, because gravity is operating on a different part of the body, different muscle groups, different areas within muscle groups, different angles of fascial patterning are being addressed. And so, in my opinion, the most effective way to tremor would be to vary positions a lot, which I don't do much, honestly, and I'm okay with that until I have a specific reason. Like now with my anterior pelvic tilt, having a specific reason to change my position, and I think I will tremor like this many times and prefer this for weeks or months. And here I feel complete, but I am just integrating a bit, lying in this position, kneeling in this position. All right, thank you for joining me, and we will see you next time. Bye.